What are the two rhythms listed? 1. Atrial flutter and atrial fibrillation. 2. Atrial flutter. 3. Atrial fibrillation. Or 4. Atrial flutter, atrial fibrillation. What do we think? If you guys chose 1, you are absolutely correct. So rhythm 1 is atrial fibrillation and rhythm 2 is atrial flutter. So if you look at the picture, some of the characteristics that differentiate A flutter from A fib is A flutter tends to have those flutter-like waves, also known as a sawtooth pattern. And sometimes the pattern can appear regular or irregular, whereas A fib usually has an irregular pattern. Both rhythms can cause a rapid pulse, and because of reduced pumping of the heart, it can cause your client to complain of palpitations, weakness, fatigue, and even shortness of breath. Also, both rhythms can predispose the client to blood clots, which can then lead to a possible stroke, which is why sometimes you'll have clients that have underlying AFib or A-flutter that are typically on a blood thinner, and they may also be prescribed a beta blocker or an antiarrhythmic in addition.
The nurse is assessing a client with hyperthyroidism. Which of the following findings would be consistent with hyperthyroidism? So what do we know about hyperthyroidism? That means that there's too much thyroid hormone. It puts the body into this hyperdrive kind of state. The heart is contracting more forcefully. The vasodilation in the extremities is making you overly warm and have increased blood flow to your extremities. So we know that there's more activity going on. So let's keep that in mind when we look at the options here. Option 1, thinning hair and cold intolerance. Thinking about how hyperthyroidism increases perfusion to the extremities, thinning hair is something that happens when you actually have reduced perfusion with hypothyroidism, so it's easy to get those mixed up. But with hypothyroidism, you have a lower metabolic rate. Things are not being perfused as well, and so the hair doesn't grow normally. So they have thinning of hair, and because they're not having as much warmth to their extremities, they do become intolerant of cold, like cold temperatures. So that would be consistent with hypo, not hyperthyroidism. So that one's not correct. Option 2. Palpitations and elevated heart rate. This is more consistent with a hyperthyroidism. So I'm leaning towards this option because, again, the heart is working harder in hyperthyroidism because of the extra thyroid hormone. So going a faster heart rate and feeling palpitations because of that makes sense. So that's probably our right answer. But let's look at option 3, weight gain and straining with defecation. This one also is more consistent with hypothyroidism. With hypothyroidism, things are slowing down, your metabolic rate is lower, it's harder to burn calories, so you are going to have weight gain. So this doesn't make sense for our correct answer. Also, straining with defecation, that's more like a constipation. Patients with hypothyroidism have trouble with gastric motility, things slow down, so they do have constipation and straining. So that's not our correct answer here because we're looking for hyperthyroidism. Option 4, fatigue and prolonged menstrual periods. This one is also more like hypothyroidism. You have a lower metabolic rate, so you're tired, and then also you have prolonged menstrual periods because this disruption in thyroid hormone production also affects the production of progesterone by the ovaries, which is normally meant to stop your periods. It can't do that because there's not enough of it, so then you have longer, heavier periods because of that. So then this one is also not matching up with our hyperthyroidism, so also incorrect. So we go back to option 2, palpitations and elevated heart rate. That makes sense for hyperthyroidism because we're having increased cardiac activity. So that's our correct answer.